Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
Okay, well, hello. We're so glad to be back with you today. We're very excited about our two guests today. We're going to talk about colon cancer. I have two wonderful ladies who are joining me today. The first one is Priscilla Thomas-Keith. She is a healthcare attorney and professor of law. Her primary focus is health and public healthcare law and policy. Priscilla is also a colon cancer survivor, and we're blessed to have her included in this discussion today. Additionally, we're blessed to have Danyelle Loveless, who is a board-certified family practice physician who has been in practice for over 24 years in the community healthcare network. Her desire is to give exceptional healthcare to her patients and provide them with knowledge so that they can make informed choices regarding their health. So one of my mantras is that knowledge is power. That's one of the reasons for this podcast. So thank you both for being here. And I first would just like to start with a few statistics. And I looked these up on the American Cancer Society website. And in the United States, colorectal cancer or colon cancer is the second most common cause of cancer deaths when numbers for men and women are combined. And the American Cancer Society estimates for the number of colorectal cancers in the United States for 2024 are over 100,000 new cases of colon cancer and about 40 or 46,000 of them cases of rectal cancer. It is reported to be the third leading cause of cancer-related deaths in men and women. And for me, as a person in women's health care, reported to be the fourth leading cause of death it's the third leading cause of death in men, according to this website, and the fourth leading cause in women. The good news is that the rate of people being diagnosed with colorectal cancer has dropped each year since the mid-1980s. But I should preface that by saying it's dropped for older people. And that the incidence seems to be rising for younger people. And maybe that's related to our ability to screen and diagnose it. Maybe that's related to some risk factors and other things. And we're going to talk about all that and what some things we might want to educate people on and look for. But Priscilla, I thought we'd start with you and your story and your journey through this cancer diagnosis.
Thank you, Lauren. It's a pleasure to be here and to share my story. Actually, my journey began in the fall of 2021 when I noticed that I was having some bleeding, and I'd always been a proponent of getting my colonoscopies on time. And the last one that I had came out well. No problems with that, but noticed that there were some issues here. And so I contacted my primary provider, talked to the nurse practitioner, and she recommended, instead of doing a full-blown colonoscopy, to go ahead and do one of the test kits. And this is a caution for everybody: if you don't feel comfortable in some of the suggestions that they make, that you push back and advocate for yourself. I went ahead and did that, and it came back negative, but I was still having problems. And so in trying to get a referral for a GI, I went ahead and called myself and got into the GI. So this is the first step in learning to be an advocate for yourself and taking proactive steps, because they'll, sometimes tell you, well, we will need a referral from your general practitioner. But because I had been a patient of his prior and he had done my colonoscopies, they put me on for an interview to come in to talk to him. We got scheduled, and lo and behold, the colonoscopy showed that I did have some polyps and that they were indeed cancerous. And so, that's the first step in terms of just recognizing that if your body is telling you, your body will talk to you, it will tell you when things are amiss, or you will have a general perception that things are not right. And
And you're the
so,
best one who knows your body, right? Not
that's
some
right.
doctor
That's
you visit
right.
once a year or something like that. So
That's
don't
right. And
ignore what you know about your
But
body.
you know,
that's right. Don't ignore that, and if they are slow in responding, then you have to step up and be an advocate. So I came into this journey, number one, as a patient, number two, as a consumer, and number three, as an advocate. So those were three different positions that I took. And thank God that I did have the encouragement or the courage to call and get an appointment for myself. And
Can
so
I stop you
when,
just right there for a minute?
yes,
Because, and Dr. Loveless, like I know I get people who refer themselves to my care doing high risk pregnancy that they just
mhm,
want their own referral. It's called a self referral. There's nothing
right.
wrong with that.
It,
And maybe your insurance won't pay for it. Maybe you have to pay for it yourself, but you can call doctors, correct?
right,
And make your
right.
own. And
So absolutely you can call doctors and self-refer. Sometimes the issue becomes insurance, which should
mhm,
not be the blockage for you to get your care that you need. But sometimes for a lot of people it is, because then we start looking at cost. But at the end of the day, you know your body, and we have to, I always tell people, I treat patients. I don't treat recommendations. I don't follow what insurance. I treat the patient. That's where the goal is. So as a clinician, I need to listen to the patient. And people know their bodies. People know their bodies. And so some of the recommendations, even for what's appropriate for screening or when to refer, we can't go by those because those are recommendations. We have to look and listen to the person who is sitting in front of us. And I think that's where the key becomes, because a lot of times they'll say, well, you've had a colonoscopy in the last 5 years. It was normal. We did a hemocoat. It was negative. It was probably just a hemorrhoid, or you strained and you had a tear. You're
exactly,
fine. That's
exactly.
what they will say.
That was
But
the response I got.
I know it was the response, because that
Hmm.
is what would be said. You've had a recent colonoscopy within the last 5 years. It was normal. We did a hemocoat. There was no blood. So most likely when we talk about rectal bleeding, we're thinking hemorrhoid, we're thinking anal
Hmm.
fissure, we're thinking a tear. Eat more fiber, drink more water, you're fine. But if your body is saying, this is not a hemorrhoid, I didn't have a hemorrhoid, I didn't strain, I didn't tear, I had this blood and I'm not feeling right, you did the appropriate thing. You did the
That was
appropriate
the
thing.
exact response that I got, but I still felt that something was amiss and I was not going to let it go. And so,
Mm-hmm.
as you say, I self-referred. I called my own GI
Mm-hmm.
who had done my colonoscopies before, went in, talked to them, we got scheduled. And lo and behold, I think everyone was surprised that it did come back positive for cancer. And so when the doctor called to give me the news, his first response was, "How did we get here?"
hmm.
He looked at the records and he asked me to walk him through the steps in terms of when I first started having these symptoms to now. He wanted to know, was there anything missed? And the last words that I had from him for saying, "We're going to right. We're going to take care of this. Don't you worry about a thing in terms of scheduling, getting into the oncologist. I'm going to take care of that." And I don't know what his concern was, that it took too long from the GI to him to get me in, or that I had to self-refer. Um, and then, just as you say, Dr. Lovelace, just because you had a negative colonoscopy doesn't mean that the next one will be negative as well. And so from there to getting into my oncologist, it must have been about a week. They didn't waste time. I went in, and from that visit, I was getting chemotherapy within a week. So I had 6 rounds of chemotherapy, then surgery, then the following 6 rounds of chemotherapy. And my response to the initial chemotherapy was excellent. The tumors shrunk and some were gone. And so that made the surgery a bit more effective when they had to go in. So, the second step was as a patient, not to be afraid to ask questions, not to be afraid to push back, not to be afraid to do your own research, and I think the fourth one is do what you think is best for your body, for your mental and your spiritual health, because you're on a journey, not only that you're walking with your oncologist, your general practitioner, you're walking with the nurses, the GI group, but you're also walking with your family. And so, understanding that they are walking on this journey with you as well. And they have concerns, they are frightened, they are scared, particularly because you may be the glue that holds the family together. And so you have to, you're still constantly juggling. And the one thing that I also learned is that to put yourself first. There will be times where you will have to say no, and you say no in a non-guilty way.
I always
And
say no is a
yeah,
complete sentence without
you say
explanation.
without explanation. And I remember talking to a friend, a former colleague, who asked me why, I left my former job. And my response was that I had 2 choices. And one of those was to live. And so I chose to live. Nothing against the former employer, great organization. But for me, I recognized that I needed more time for myself. I needed less stress in my life, and I needed to be able to move forward with intentionality.
I love
I
that.
think I love that too. I think it's so awesome. I think as women, particularly, we feel like we have to take care of everybody else. We are very nurturing people, particularly,
Right.
quite frankly, as Black women as well. But I always laugh. My husband used to tease me because I'd come home. I just told you before we started talking that I eat about every 2 hours and my brain doesn't really function well. So we'd come home and I'd sit down and eat dinner before my girls would, and he said, "Oh, you're always eating before before the kids are." I said, it's like on that plane, put the oxygen mask on yourself first. If I take care of
Right.
me, if I take care of me and the stress that I'm feeling through this job, nothing about the job, just not the right job for me, and move on to something else, or what you eat, or just taking time to go do your nails once a month, or something that makes, you feel better about you. It's important to take care of you, not exclusively and to the point where I ignore everybody else. But if I can't take care of myself, I can't be the best me to help the other people.
So
So
what I
I,
always tell,
Exactly.
yeah, what I always tell people is that self-care is not selfish, right? Self-care is not selfish, it's self-sustaining. We need to take care of ourselves. I think as women, we're naturally nurturers, as you said, Lauren, in that we pour out. We're vessels and we pour out to everyone, right? But as a vessel, if you don't get poured into, if you don't get refilled, replenished, you're empty. And so then you're not good for yourself, for your patients, for your family, anywhere on your job. You're just not good if you're not whole. So taking care of yourself is not selfish, it's really self sustaining. And it's important to get replenished. And how that replenishing looks varies from person to person. Like you said,
mm-hmm,
whether
mm-hmm.
it's going and get your nails done, whether it's, taking a weekend where you're not doing anything but relaxing, whatever that looks like for your self-care, for your sustenance, you have to do it. You have to do it. And one of the things that you said, Priscilla, that really rings true. I am a physician, but I always tell my patients I sit on the other side. So I understand the vulnerability when you come into a physician's office, that's a vulnerable place. You are vulnerable in that you pray and hope that they're going to listen to you, right? And
Right,
and in listening to you, they're going to deliver care that's going to be in your best interest because you're not the physician, right? So that
right.
is a very vulnerable space. It's a vulnerable space for me. And I clinically know a lot of things, but I can't treat myself. I can't treat myself. So the thing is that I always tell patients, if I say something, I say, I'll give my advice and say, well, what do you think about this? How is your feelings about this? I said, because if you're not comfortable with this, then we need to go to another step to make you comfortable. If that next step is having you see somebody else, let's do that because I need for you, when you walk out that door, to feel comfortable with the health care that you're receiving. So if I've said something, or if you're like, this doesn't sit right, let's get you to the right place. Sometimes the right place is not with me. Sometimes it's referring to a different network. I've sent people to Cleveland Clinic. I've sent people to Mayo Clinic.
Mm-hmm.
I said, let's get a second opinion. I need for you at the end of the day that when you lay your head on that pillow, that you're comfortable with what has been done for you for your healthcare. So I applaud you on all levels for being proactive in your healthcare.
Oh, definitely. Because the third one, I talked about being a patient, the vulnerability, but also being proactive. And I think I've talked about advocating for yourself, but you're also a consumer.
You are.
And so, as a consumer, I liken it to when you buy a product and the product doesn't work. We never fail to take that product back or
Amen.
complain that this doesn't work. And so, I've learned that as well that healthcare is not free,
No.
and I'm paying for
Amen.
these services. For them in premiums, paying for them in deductibles. And so as a consumer, I recognize my position and my authority in that process. It doesn't mean that you have to be mean or disruptive.
Mm-hmm.
Um, but what it does mean is that you take those parameters and again, I'm using the word advocate for yourself and the
Right.
services that are being provided. Because if one is recommended, but you don't feel that it's necessary or it's not right for you, you have the authority to say, no, I don't feel that this is good for me, or listen to me. I even during the treatment, face would break out. I would call and say, this is, I'm looking like, a
Mm-hmm.
headless monster here, or the teenager with
Mm-hmm.
severe acne.
Mm-hmm.
Can you provide something, for me? Or
Mhm.
I'm generally feeling tired, more tired than usual, more fatigued, what's actually happening, or I've come for a number of visits, but my weight keeps dropping. Is that normal?
Mhm.
What's actually going on here? And what are the chemotherapy agents that you're giving me? And are you giving it to me at 100% or 70%? What's actually going on? And lastly, do not, if you have access to the internet, do not be afraid to go in and read your record. Read what the hospital visit has said. You've gone in, you've had your visit. Check the notes and see if they're accurate or see if you've missed anything. I will do the caveat that when I get my scans, I don't read them. I wait for the physician to tell me because what's in the scans and I may not understand, and she may be able to explain to me in a way that I may be able to understand. So never forget that you're a consumer as well.
Mhm.
I'd like to, I want to come back put a pin in what to expect with chemo so we can go over those things again, because
Mhm.
just knowing what to expect maybe helps some things. But I want to go back to screening factors, but I also want to go back to and risk factors and screening, but I want
Mhm.
to go back to not being afraid to talk to your physician and say, maybe like Priscilla, I don't understand. And,
Right.
you know, while even during that first visit, or to say, I'm really concerned that I might have cancer. And as you point out, Dr. Loveless, you may say, well, we've done this test and that test. I said, well, I know
My
from
body.
experience that there's some people who had cancer who had those same things. So to be able, as Priscilla says, to push back a little bit, to
Mhm.
say, well, what can you do to make me feel as
Comfortable.
sure as possible that I don't have cancer? Because
Right.
that's what I'm concerned about. And sometimes I think, um, as people in general, maybe as people of color, particularly, sometimes I deal with husbands of wives with concerns who don't express what they're concerned about or don't want to express the vulnerability of, this is what I'm afraid of, and I want to be reassured about this. So I want to ask you to talk about that and to be comfortable for patients to say, I don't think I really understand what you're talking about. All that stuff you just said to me, I don't know it, you know, and I want to understand what you're saying to me. But what are your thoughts on that, Dr. Lovelace?
I think those are very important things. I have family. And so everybody in my family is not a physician. And so how many times do I get the phone calls from my family members that I went to the doctor today and they said this? I said, and how do you feel about that? Did you understand it? No. Did you tell them that you didn't understand it? No. I said, okay, so that's a problem. I said, because if you're not clear when you walk out of that door, then there was a issue with communication because you should have
Mhm.
understood what was being said. And if they're saying it in terms that you don't understand, you have to tell them that you don't understand. I
Mhm.
said
Mhm.
because sometimes as physicians we're here, we get very clinical, and we forget that the layperson doesn't know what dysplasia means. The layperson may not know what atypia means. The layperson may not know this. So we need to break it down in the simplest form to say dysplasia is an abnormal cell. It's not normal. It may not be cancerous, but it's not normal. So it makes us need to do this. And so if you don't understand that, you have to tell them. But it's also our job as clinicians to take a moment and a pause to ask the patient, do you have any questions? Does this make sense? Hey, why don't you call your daughter or your son or
Mhm.
whomever and put them on speaker so
Mhm.
we can have this conference? Because when my mother goes to the doctor, trust and believe, she's in Michigan. I said, Mom, I'll step out the room, but I need for you to call me when you're in that visit because she may not get it, right? And
Mhm.
so you have to advocate, as we say, but as physicians, we have to feel comfortable that if somebody questions us, it's nothing to be offended about. I'm never offended because I work for the patient.
Mhm.
And so my job is to treat and take care of the patient. So I should never be offended if they say, I don't feel comfortable with that. Well, let's get you to a place where you are. Let's get you somewhere else. Let someone else look at this, a fresh set of eyes and a different perspective. But at the end of the day, my job is to make sure that you are 100% comfortable with the care that I'm delivering. And if you're not, then I need to get you there. And then if it's still a matter and you feel like you need to go elsewhere, I'm okay with that. But I have to make sure that I've done my due diligence as your physician.
And just a plug to say that's why you want to find a physician that you're comfortable with before you start to have issues. You want to build a relationship, have somebody you trust before.
Right, exactly.
Uh,
And that's the thing in terms of relationships. And sometimes, we're not going to get into this the big semantics of healthcare systems and how things work, but as a person who has been doing this for greater than 25 years and been with one network for 24 years, there's a lot of things in medicine that can say have been good over the years in terms of progress, but there are some things in medicine that I'm like, I'm old school. I want to know my patients. I'm
mhm.
okay with you
Mhm.
seeing a physician assistant or a nurse practitioner for a cold call, but at the end of the day, it's the relationship. It's a matter of trust. And I don't want so many patients that I don't know them. that I don't know their family history, that I don't know the nuances within how they may communicate and where their level of comfort is, because that's a lot in that relationship, that patient-doctor relationship. And sometimes I think as we progress in healthcare, they feel like the way we deliver services should be different. Some stuff just needs to be basic, old school patient-doctor relationship. And so me and my strong personality sometimes have conflicts with administration because of that. But I have to fight. I fight for that as for my patients, but I fight for that as clinician to make sure that I feel comfortable in the care that I'm giving. And if I'm not feeling satisfied that I'm doing a good job, then I need to make sure that those things are in place that I can feel comfortable that I'm doing the job that I'm supposed to do for the care for my patients. Because I want to deliver the care to my patients as though they were my family members, right? I want the care that I give to every patient, the same care that I want for my family. And I always say, I don't like all my family, but I love all of them. I love them. I don't like them all the time, but I love them. And I want them to get good care. So when a patient walks through, I got to look at that patient as my sister, as my niece, as my uncle, as my cousin. Am I giving them the care that I want my family to have? That's how I approach medicine. I'm a family practice physician. I want to give the care that I want my family to have. Access, all of that.
Exactly. I totally agree with you. That's my philosophy as well. So, and I will just add this, I always too say, do you have any more questions at the end? Any more questions? Any more questions? I keep asking that. I get questions that have nothing to do with me that I'm like, you're going to have to ask your primary doctor. But I learned that from my mother, who I would go to a visit with her. She'd come back, as your mom said, and she said, well, do you think this or that? And I said, well, why didn't you ask the doctor when you're there? Oh, they're so busy. I didn't want to bother them. And so I try to let my patients know I
This
make,
is your time.
this is your time. It's just
Right,
me and
this
you
is your
here.
time.
This is your time. This is you. And I'll stay here as long as you need me to. I'll catch up on the other ones later. But I want them to feel like their questions have been addressed. And that's not always the case, but that's what they're there for. And doctors, I can't speak for everybody, but certainly we're busy, but the good ones are dedicated to answering your questions and helping you understand what's going on.
Right.
And so don't be afraid, don't be intimidated, don't be afraid to say, I don't understand, don't be afraid to say, well, I did wonder about this, because you go home wondering about it. You don't need to
Right. And
wonder.
I'm like, some people, I'm like, just who is your caregiver? Who's your advocate? Who do you confide in and trust in your healthcare, in your family? Can we get them on the phone too? Because sometimes we need another set of ears. Because sometimes they don't hear what you're saying in those moments. So let's have another set of ears on board.
Imagine, particularly in cases like, well, you might say, oh, we're concerned that you have colon cancer. We're concerned that you have this or that. That's all you heard, and you didn't really hear anything after that. To have a second person who, even as knowledgeable, adequate as you are, educated, or to understand it, when it impacted you this way, maybe you didn't hear much after that. It's always good to have a second set of ears. So
yeah, I've had
It
health
always
issues
is.
myself. And I'm a physician, but I'm gonna tell you, in that moment when I was getting the news that was not great news, I didn't hear anything. My sister was with me, and I said, she said such and such. She said, she didn't say that, baby. That's not that's not what she said. I said, well, she said, no, that is not what she said. You're hearing what you want to hear, right? I was like, but she said, no.
Amen. It's so true. And it's so natural. It's so normal. Don't be
Right.
intimidated by that and understand those things. Were you going to say something else, Priscilla?
No, I was just going to tag and say it's always good to have someone else in the meeting with you, particularly as you start out in your journey, because it is true. You may hear something and they may hear something different. When we spoke to the oncologist and my surgical team, one of the lead surgeons, and he was explaining what he was going to do. I went home and slept like a baby, but my husband didn't sleep all night because he heard something different.
Mm.
And I was coming at it from a spiritual perspective in terms of telling the physician, well, you do what you need to do, and I'm going to do what I need to do from a prayer perspective, and walked out. And that was it. But my husband understood the gravity of the situation, and he didn't sleep, all night because he heard exactly what the doctor was saying. I heard it, but sometimes your body and your mind, particularly your mind, will adjust such that you are able to take it in a way that will not allow you to go into deep anxiety or deep depression, because it knows what you will have to deal with. And I've learned on this journey that cancer every day is a new step in this journey, and so you have to just take it one day and sometimes one moment at a
Yes.
time. So it is true, Danielle, no, they didn't say that, baby. But in
I
my
had a
case,
whole
was like,
conversation
he
that my
did say
sister
that,
was
and I
like,
just went home and slept like a baby.
yeah, my sister was like, she did not say that. I was like, yeah, I know she didn't. So we'll have to come back to that because that's not what was said.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.